Hyperalimentation. Total parenteral nutrition, TPN, contains water, protein, carbohydrates, fats, vitamins, and trace elements that are necessary to the healing process. It is a very strong hypertonic solution. Partial parenteral nutrition, PPN, is normally prescribed for patients who can tolerate some feedings but cannot ingest adequate amounts of food to meet their nutritional needs. Nursing management. Filter is used in the IV tubing to trap bacteria. Solution and tubing equipment should be changed every 24 hours. If a new bag is not on the floor, hang D10 while you wait for the new bag because you cannot abruptly stop the infusion. TPN is to be tapered down. Dressing changes every 48 to 72 hours with the antibiotic ointment to catheter insertion. Medication should never be administered in a TPN line. TPN may be the only feasible option for patients who do not have a functioning GI tract or who have disorders requiring complete bowel rest. The TPN should not be used for any other purpose. External tubing should be changed every 24 hours with the first bag of the day. Dressing should be kept sterile and usually changed every 48 hours using strict sterile techniques. If TPN is given outside the hospital, patients must be taught to recognize symptoms of infection and qualified home nursing must be arranged. Complications include infection and may cause side effects such as mouth sores, sudden poor night vision, and skin changes. Before you administer TPN, look at the solution closely. It should be clear and free of floating material. Gently squeeze the bag or observe the solution container to make sure there are no leaks. Do not use a solution if it is discolored, if it contains particles, or if the bag or container leaks. Severe hepatic dysfunction is a rare complication. Liver failure, often related to fatty liver, may sometimes occur. This condition is generally due to excess in glucose provided in TPN solutions. Overall, patients receiving TPN have a higher rate of infectious complications. This can be related to the hyperglycemia. The most common complication of TPN use is bacterial infection, usually due to the increased infection risk from having an indwelling central venous catheter. In patients with frequent bacterial infections, fungal infections can also occur. TPN increases the risk of acute cholecystitis due to not using the gut. This results in bile stasis. Another more serious procedural complication of central venous catheter placement include cardiac tamponade or arrhythmias caused by irritation from the guide wire or losing the guide wire in the vein and major venous air embolism through the catheter itself. Cardiac tamponade is the compression of the heart that occurs when blood or fluid builds up in the space between the myocardium, which is the muscle of the heart, and the pericardium, the outer covering sac of the heart. This can happen after any invasive heart procedure. Gallbladder complications include cholelithiasis, gallbladder sludge, and cholecystitis. These complications can be caused or worsened by prolonged gallbladder stasis. Vitamin and mineral deficiencies are rare when solutions are given correctly.